Hey guys, welcome back. So in this part of the video, we'll be talking about the anatomical as well as the functional lobes of the liver. Okay, so let's talk about the anatomical lobes of the liver first. So anatomically, the liver basically has four lobes: the right, left, caudate, and quadrate lobes. And the right and left lobes are separated by the falciform ligament, as I've mentioned before. Okay, falciform ligament is actually the one which actually separates the right from the left lobes. Okay, from the front you can only find out these two lobes. Only when you go to the from the diaphragmatic surface only you can find these two lobes. Only when you go to the visceral surface you can actually find the another two lobes, that is caudate as well as the quadrate lobes. So as you go there here, then only you can actually find this caudate as well as quadrate lobes. So this is actually the caudate lobes and this is actually the quadrate lobe. This is actually the right part, left part, caudate. This is caudate and quadrate. Okay, when we want to find out the caudate and quadrate lobes, it can be identified from the H shape. Okay, it can actually be find out. It can actually be founded from this H shape. So the H shape that I meant here is this one. Where's the okay, this is the H shape that I mentioned that I would like to tell. So the one that is horizontal here, that is actually known as a porta hepatis. Okay, here is also known as the umbilical fissure, also known as a left sagittal fissure, where it is a connection between the ligamentum venosum as well as the round ligament or the ligamentum teres. And this is actually the right sagittal fissure. It's of course all these things are actually imaginary lines. Okay, and this is actually also known as a right sagittal fissure, which actually connects. Okay, just now I said this is the one hepatocaval ligament is the one that actually connects. Actually the way where the inferior vena cava pass through, and this indentation is where the gallbladder is situated. So the right sagittal fissure is actually a line, an imaginary line from the IVC that connects the IVC to the gallbladder. So from here we can actually find all the four lobes. That is the the left lobe, right lobe, caudate, and quadrate. Okay, this H shape is important to find all the four lobes on the behind part. Okay, so anteriorly we use the falciform ligament to divide into right and left lobe. Posteriorly we will use the H shape to divide them into all the four lobes. Okay, so that is all for the okay, one important thing is this. Okay, undo. Okay, see here, this falciform ligament is on the diaphragmatic surface and their counterpart on the visceral surface is this left sagittal fissure or umbilical fissure. Okay, that is one important thing that you have to know. Falciform ligament, the counterpart on the visceral surface is left sagittal fissure. So from here you can know that okay, this is the one. Okay, that's all for this. So that is all for anatomical lobes. Now we will go into functional lobes. Okay, functional lobes, we will use another imaginary line known as the Kuntlis line, and this Kuntlis line is actually situated here. This Kuntlis line is the one that actually connects the IVC and gallbladder, and this Kuntlis line is actually going to divide the lobe into right and left once again. Into right and left once again. But again, when you divide the right and left lobe using the falciform ligament, the right lobe is bigger than the left lobe. When you divide the liver using the Kuntlis line, it is still gonna be the right lobe bigger than the left lobe. Okay, anything either falciform ligament or even the Cantley's line. Cantley's line is an imaginary line. Okay, anything that you use to divide the lobe, the right lobe is still gonna be bigger than the left lobe. So Cantley's line, all you need to remember is that it connects the IVC to the gallbladder. Okay, so it is like when you go into the front part. Sorry, done. So when you go to the front part, the IVC and gallbladder okay, this would be the IVC, this would be the gallbladder, the Cantley's line would be here, okay, to the right of the falciform ligament. Okay, so now I'll be going to the PowerPoint presentation where I'll be talking further on this functional subdivision of the liver. Okay, so to find out the functional lobes of the liver, we have to use three imaginary lines. Okay, the first one is this one. This is actually the Cantley's line. Okay, this one is actually the Cantley's line, and this one, as I mentioned before, okay, you see inferior vena cava, gallbladder, so the function, the imaginary line should be the Cantley's line. The one left to it from the front from the front view, the one left to it is the falciform ligament. Okay, this line is also known as the falciform ligament. And the another imaginary line, this one is not the imaginary line, of course, this one is actually a falciform ligament, but yeah, we are trying to divide, that's why we have put it in a separately, like in a dotted shape. And another imaginary line is actually this one. Okay, this one is also known as the right, this imaginary line is also known as the right portal fissure. Okay, so it's very important. Okay, why we have to divide them into all these lines and all these segments is because then only okay, why we use all this line and not falciform ligament? Because when we use falciform ligament, it is actually not dividing the liver into proper segments which actually have their own portal, triad, supply and venous drainage. But then when we are actually using this, all these three lines, Cantley's line, right portal fissure, as well as the falciform ligament, as well as this line, okay, then we are actually dividing the liver into segments which actually has their own portal, triad, supply and venous drainage. So this means that the liver actually can be segregated into their own independently, which means, let's say you actually have a cancer on this part of the liver. Okay, all this functional subdivision is actually an important basis in hepatic segmentectomies. Okay, that means like if you want to remove one part of the liver, all this you have to know this you have to have this knowledge in the functional subdivision of the liver, because let's say you actually have a cancer on this part of the liver, you only have to remove this part of the liver because they are having supply of the blood as well as venous drainage that is independent of other segments of the liver. Okay, you don't have to remove this whole part or the whole portion of the right part of the liver. Okay, so that is why we are actually segregating it into the functional subdivision of the liver. Okay, so when I am talking about the portal triad, what I mean is this one. Okay, the portal triad means each segment would actually be receiving. Okay, portal triad means it will actually have a combination of common bile duct, hepatic artery, as well as the hepatic portal vein. Okay, they are branches. Okay, they will have these three components in one portal triad. That is what I was referring to whenever I was mentioning portal triad before this. Okay, so now I'm gonna tell you how to name these segments. If it comes up in the exam, you must know how how to name the segments. And I have to make a correction. Here it is written like right lobe and left lobe. All these thing is known. All these lobes are known as a posterior or anterior, and the left lobe are known as a medial and lateral. No, the new update of if you follow Moore, I mean Moore is an universal anatomical book. It's an atlas that is followed by most of the like anatomy guys, anatomy lecturers, and all this stuff. So based on that, I would say that okay, there is a correction that after this, both right lobe and left lobe we will just use medial and lateral. Means left lateral, left medial, right lateral, right medial. The only thing that you have to add on is whether it is posterior or anterior. Okay, for example, let's say I talk about this number 8. Okay, that means I'll call it as right medial. Okay, this one is lateral, this one is medial. Right medial posterior. Why I call it as right medial posterior is because when you compare it with the number 5 here, segment number 5 here, this one is a bit more towards the back. Okay, towards the back. This one is a bit more to the front. That's why that's why it is called as a right medial posterior. Okay, remember this. This is the new update on how to call all the segments. So now we will talk about all the segments of this. We are not going to go into all the segments. We are just going to talk about the important one. Okay, all these okay, this is the first segment, also known as a caudate lobe. Second, third, fourth segment, fifth, sixth, seventh, eighth. So it goes around like a clockwise, yeah, in a clockwise direction. 1 2 3 4 5 6 7 8. Okay, just remember in a clockwise direction. So as for this first segment, it is known as a lever within lever. Okay, this is the caudate lobe. This is known as the lever as in the lever itself. Why? Because okay, all the segments are actually supplied by one tertiary portal triad as well, one tertiary portal triad as well. I think I have a better picture on this. Okay, one tertiary, each portal triad or each segment is actually supplied by one tertiary portal triad as well as one tertiary venous drainage. As you can see here, okay, the third degree means tertiary. Okay, third branch. Same goes for the venous drainage. All of them are actually receiving one portal drainage, one portal triad as well as one venous drainage. Means there is two okay, yeah, one portal supply for triad as well as one venous drainage. So that is for other segments. But when we go to the first segment, it is supplied by two portal triads and two drainage directly into IVC, and it is also different from other segments because others are receiving tertiary branch. This one lobe is only receiving the secondary branch. Okay, so two venous drainage and two portal triad, both are secondary branch for the first lobe. The another thing that you have to remember of all these lobes is for the fourth lobe. As you can see here, the fourth lobe, all of them are actually having like a horizontal subdivision that actually divides them into two. But for the fourth lobe, it is not divided into like a two division. It is not divided into two division. Why? Because the the portal triad is only present at the lower part. Okay, the portal triad is only present at the lower part. There is no portal triad in the upper part. So if you want to remove, you have to remove the whole portion, not only the below portion, because if you remove the below portion, of course the upper portion also we can't be able to use it. So as for the fourth, okay, this is the final part of the video. What is so special about this fourth segment is for the fourth segment, it is still supplied by the tertiary drainage as well as the like other segments. It is still supplied by the tertiary drainage, but it is still supplied by the tertiary portal triad as well as the tertiary drainage. However, instead of having one hepatic vein drainage, they are actually having two hepatic vein drainage. So